The intention to treat her chin line is to balance the very smooth transitions of her cheek lines into the lower part of the face, because she had, in contrast to the upper part of the face, a significant volume loss in this chin area, which leads to a little bit of sharp impression in that lower part of the face. So we have chosen to use Juvederm Voluma here in order to provide a good tissue suspension. As we can see here, a very defined mental crease going almost all around her chin arch. I prefer to inject perpendicularly with a sharp needle in single bolus technique, which is less painful for the patient and less traumatizing to the underlying tissue. So after having identified the area of volume loss, I start laterally. Here I stretch the tissue. I inject with a 27 gauge needle Juvederm Voluma going down to the bone, aspirate and inject slowly in perpendicular pillar technique, 0.1 cc of Voluma. And after the first injection point, you can, in her profile, already see a softening of the transition of the perioral area into the chin area, and that gives her a softer, more friendly, less sharp appearance. The second point, more medially, about 1 centimeter more medial than the first one, going again perpendicularly. Are you okay?
Mm-hmm.
It's not painful at all. I'm aspirating again. In the assessment, it is very important to pre-assess whether she has an optimal length of the chin line compared to the rest of her face. In her case, the absolute length measured from the lower lip to the tip of the chin was good. So I tend not to elongate her chin in this case, but rather only filling this significant crease in the middle of her chin in order to soften the transition. 1 to 1.5 centimeter more medially, again perpendicularly, injecting slowly Juvederm Voluma supra periostally. Here, due to the very strong contraction force of the mentalis muscle here, the mental crease can become really deep. So I start in the middle of the mental crease here. I stretch the chin down a little bit in order to demonstrate the crease, and I inject just in the midline perpendicularly. Is it okay?
Mm-hmm.
And you see, after having increased the tissue resistance by injecting Juvederm Voluma here, the chin does not form back into its inverted shape anymore, but it stays a little bit more open, and we have softened this area by injecting.